So today I'll be talking about a tibia and a fibula break. So the pathology and disease process behind the break is it typically occurs after some type of trauma, which could include a fall, a motor vehicle accident, a sport injury, or a direct impact injury. So these fractures can be open or closed, meaning it could be just within the skin or it could protrude out of the skin. So with these fractures, patients will typically experience pain, discomfort, swelling, bruising, instability. And recovery time will vary based off of the patient's age, gender, or any comorbidities they have. So patients may experience complications with this injury, such as malunion, infection, or compartment syndrome. And to determine and give a patient this diagnosis, the patient will undergo a physical examination and an x-ray. So the population that's affected and the statistics. So typically it occurs in men more than women and has an incidence of 21.5 per 100,000 people. So men tend to sustain this kind of fracture between the ages of 10 to 20 years old, and women tend to have this fracture between the age of 20 to 30-year-old. And it's most common between children between the ages of 2 and 8. And people with comorbidities and underlying medical conditions such as osteoporosis are at higher risk to have a break. So now let's talk about how we're going to treat a patient with a tibia and fibula fracture. So the main focus and goal is to follow doctor's protocols, which includes weight-bearing status and motions that are allowed. So in the early stages, typically we'll focus on gentle range of motion and pain reduction by modalities. So for example, specific exercises should be like ankle alphabets, which is a range of motion exercise, strengthening of surrounded areas such as lumbar quads, and training on weight-bearing status. So if the patient's on crutches and they're non-weight bearing, we need to teach the patient the gait pattern and how to use the crutches. And then we're also going to provide manual passive range of motion, and then we'll also do ice to reduce the swelling and pain. So then as we're able to progress with doctor's orders, we can start strengthening and balance exercises such as standing on an Airex, ankle isometrics, passive range of motion and active assisted range of motion stretching, and scar massage to prevent adhesions if the patient required surgery. And then as we progress and we get to the end stages of therapy, we'll focus on more functional motions such as squatting, lunges, more challenging balance exercises, and for athletes, we'll focus on very intentional movements that are required for their sport. So now let's talk about medical interventions that the patient may receive. So when a patient is diagnosed with this injury, typically after maybe an x-ray or an MRI, there's a few things that can be done. So if it's just a small hairline fracture, the doctor may believe that it will heal on its own. So the patient may just require like immobilization or a brace and may have limited weight-bearing status or just have limitations. And then if it's a more advanced break, the patient will likely require surgery. So during surgery, the surgeon will likely place an ORIF, open reduced internal fixator, or an X-fix, which is external fixator. After surgery, the patient will be immobilized for a prolonged period of time. And whether the patient requires surgery or not, the doctor will likely recommend physical therapy for the patient. So now let's discuss why I chose this topic. So although I experienced this very same break and I required surgery to get an ORIF, and I went through the physical therapy recovery process, I really only ever saw it from a patient's point of view. I never really did a deep dive into my diagnosis, my surgery, or my physical therapy process, partially because at the time I didn't know that I wanted to go to school to be a physical therapist assistant. And this kind of kick-started it and made me want to come to this profession. So, by choosing this diagnosis, it gave me an opportunity to learn more about it. Diving deeper and getting a better knowledge gave me a different point of view to my injury. It allowed me to understand exactly how and why my physical therapist treated me. So now I kind of understand why the exercises they gave me were so relevant to my diagnosis and to get better. So it allowed me to exactly see how thankful I am for this profession and gave me a first-hand view of why physical therapy is so important. Thank y'all.